Okay, so what if healthcare wasn't something you had to buy, but was just a fundamental right for every single citizen? Today, we're diving into one of the most ambitious attempts anywhere on Earth to make that a reality, Brazil's Sistema Único de Saúde, or as it's known, the SUS.
All right, so here's how we're going to break this down. First, we'll get a sense of the incredible scale of this system. Then we'll jump back in time to its revolutionary origins. After that, we'll unpack the three core ideas that hold it all together. And finally, we'll look at a really powerful example of what the USS can do.
So, to really get the SUS, you first have to wrap your head around its just breathtaking scale. I mean, we're not talking about a small, simple program here. This is a healthcare system built for a country the size of a continent.
The SUS is, without a doubt, one of the largest and most complex public health systems on the entire planet. And its mission is massive: to give comprehensive, universal, and totally free healthcare to every single person in Brazil.
And when I say comprehensive, I really mean it. This is not just some basic safety net. We're talking about a system that guarantees access to a huge range of services, from something as simple as a blood pressure check at a local clinic all the way up to incredibly complex and life-saving organ transplants. And it covers every citizen, from before they're even born throughout their entire life. So how in the world did a system this revolutionary even come into being? Well, it wasn't a slow and steady evolution. Nope, it was a full-blown revolution born out of a really pivotal moment in Brazil's history.
Okay, so picture this. Before 1988, healthcare in Brazil was basically a privilege. It was tied directly to your job. If you had a formal contract, you were covered. But that left a huge part of the population with nothing. Then, in 1988, with a new constitution, everything changed. Health was completely redefined as a fundamental right for everyone.
In this single sentence, written right into the Constitution, is really the heart of the whole thing. Saúde é direito de todos e dever do Estado. It means health is the right of all and the duty of the state. And with just those few words, the game was changed forever. Healthcare became a guarantee.
Now, you can't run a system this gigantic on good intentions alone, right? It needs a really strong philosophical foundation. And the SUS has exactly that in its three guiding principles. These are pretty much the bedrock of every single decision that gets made.
So these three pillars are universalization, equity, and integrality. Think of them as the system's DNA. They shape absolutely every policy, every program, every action.
All right, the first one, universalization, is simple, but it's so powerful. It just means everyone is covered. It doesn't matter who you are, where you come from, what you do for a living. Access to healthcare is your right as a citizen. Period. No questions asked. The second pillar, equity, is where things get a little more sophisticated. It's this recognition that universal doesn't mean one size fits all. You know, people have different starting points, they have different needs, and a truly fair system has to account for that.
And this is such a great way to understand that key idea. Equality is like giving everyone the exact same ladder, no matter how tall they are. But equity, well, that's about giving everyone the right size ladder so they can all reach the same goal. The SUS aims for equity, which means it actually invests more where the needs are greatest. And finally, we have integrality. This is all about treating the whole person, not just a list of symptoms on a chart. It's about combining prevention, treatment, and rehab, and also recognizing that things like clean water, good housing, and education, they're all fundamentally health issues too.
So that's the theory. But what does all of this actually look like in practice? Well, there is probably no better example of the power of these principles than Brazil's national transplant system, which is a core part of the SUS.
Yeah, you heard that right. This is where the sheer scale and ambition of the SUS just hits you. The same system that provides free checkups also runs the largest public organ transplant program on the entire planet. That's a monumental achievement, and it's rooted right in that core mission of universal access.
And just in terms of the raw numbers, Brazil is a global powerhouse. It performs more transplants than any other country in the world, except for one, the United States. It's number 2 globally.
And check this out. The funding behind this is just as remarkable.
A mind-boggling 86% of all organ transplants in Brazil are paid for by the public system. That's what universalization looks like in action.
So if you're a patient, what does integrality feel like? It means every single step of that transplant journey, from all the initial exams to the surgery itself, the hospital stay, and even all the crucial anti-rejection medications you need for the rest of your life, is provided completely free of charge.
Of course, a system on this scale with this much ambition is never going to be perfect. It faces huge, constant challenges. Everything from chronic funding issues to just the immense logistical strain of it all.
And the biggest challenge, one that's familiar in many countries all over the world, is that the demand for organs still, unfortunately, far outstrips the available supply. So even with this incredible number of transplants, long waiting lists are still a painful reality for many people.
Which really just leaves us with this one big thought. Brazil's SUS, with all of its incredible successes and its very real challenges, is this powerful, real-world experiment. It really shows us what's possible, what's at stake, and what it truly takes when a nation decides that healthcare isn't just a commodity to be sold, but a fundamental human right for every single one of its citizens.